Hi, good evening to all the students who are present here. And we have a special lecture today that is from Professor Micheal Friebe, who works with me on various things. So he was here at BMS College of Engineering exactly an year ago, so somewhere in 2019 February, where he delivered a full-length lecture about reverse innovation and a lot of other things, which few of the snapshots you'll be hearing today in his class. And professor is working, he's having his own lab, image guided surgery catheter technologies, and he's also faculty of working at Faculty of Electrical Engineering, Institute of Medical Engineering, Otto von UK University Magdeburg in Germany. And we have amazing lecture lined up. So for another 20-25 minutes and followed by Q&A. So if you have any questions, you can post on the chat window and we'll take up at the end of Professor session. Professor, welcome to the class and over to you. You can share the screen, I guess.
Thanks a lot, Abhishek. It's always great to be connected to India again. And what you have not mentioned, but you know, is that we have a huge community of Indian students. Particularly in my university, we have, I think, more than 3/4 of the students in the master program are from India. So it's always amazing what we get there. I mean, goods or bads, but it's amazing what kind of enthusiasm you guys show. So I'm very happy to have this connection. I also think that India is a great place, and you know the reasons why. You have lots of people, and you have lots of different areas. You have a difference between rural and urban areas, and particularly for healthcare, that's very exciting. So. I've also been at Kharagpur for several lectures, for entrepreneurship lectures, and I will start actually an innovation think tank program in India, and maybe we even get the BMSCE college involved in this one. So maybe we will talk about this in a sec. So what my goal today is that sh- I show you a little bit what I'm excited about. Also what I possibly have learned or not learned in my last in the last 30 years of starting about 30, I think I have a list of the 34 companies, and what I've not learned about, and possibly also what I will never learn in my life. And so I want to get you excited about the opportunities, and also want to give you some ideas and concepts that I believe you should follow with respect to innovation generation. So I also provided you some tools in this lecture, and maybe there's some way that we can discuss this later on. So you know that because you are part of this, what is it, disciplined entrepreneurship program, and probably have also done biodesign. And the biodesign is listed below. The first and foremost thing that you need to do to understand or to create innovation in that segment is to understand the problem. And a lot of people in research and development, they use what's out there, they try to improve it, but they're not really diving deeply into the problem space. So what the lesson I wanna give you on this as part of this lecture is, please do not start the solution before you have properly understood the problem. So dive into the problem. Now, once you have that one understood, do not create a solution. Ideate some potential aspects and then try to validate them subsequently. I'll give you some tools later on that hopefully will help you that. And then once you're done with that, it's time to implement it, and implement it in terms of a prototype, maybe concepts, and always clearly talk to your stakeholders. Now, the question is, who are the stakeholders in health? Very often I hear when I ask the question, it's the hospitals, it's the doctors. You know, in essence, the most important stakeholder in health is you yourself, and me and I, right? It's not the doctor, it's you who are the most important stakeholder. You need to also do things that you would like to see, and that will help you in your assessment of your health, and in the next steps, making sure that you stay healthy and your family stays healthy. So to understand the innovation potential, you also need to dive into what will happen with health, what will happen with healthcare, and what will happen with using technologies that, that are dramatically changing the healthcare delivery at the moment. So what we will see for sure is that we will move away from only creating devices and tools that help you diagnose and treat diseases and sicknesses. We will have to move to a more prevention and predictive state. I will also tell you about the 4 Ps. You may have heard those before too. So important is to avoid getting sick, not treating the sick people. I'm not saying that we shouldn't treat people when they're sick, but it is really interesting to provide devices for oncology. But more important, it would be, and more incredibly, would be to avoid from people getting cancer. So you don't have oncology anymore, right? Getting rid of it. So, but this thinking process is a little bit more complicated and obviously more future oriented, and also a little bit more difficult with respect to financing and creating business models. Now, what we will see is something called precision medicine. So we will use advanced tools to actually assess your state. We will have something that we will judge healthcare delivery based on the results. That's what we call value based. So we will not try out things. We will actually get reimbursed in the future based on the results that these treatments will create. And we will actually have the patient in the center rather than being shoveled around from left to right, moved around in a hospital from left to right, go to the radiologist, go back to the clinical, to the general practitioner, go back to the internal medicine. That people will take care of you inside that system. Hopefully, at least they will. Now, you have heard the word disruption, I hope at least, and incremental innovation. Disruption is when you actually rethink, processes, procedures completely. So you don't actually improve it a little bit, but you completely rethink how it could be done. So in terms of healthcare would be, does it really have to stay in a hospital and a doctor? Could we not do healthcare delivery at home? Now, when you think that way, you also have to rethink business models because it will not actually match the business models that you have at the moment. Healthcare as a business. Now, if you really think about this healthcare as a business, you may have to you may realize that we may have to shift a little bit on that concept in the future. And having said that, one of the items that is most important about healthcare delivery is creating devices, tools, and processes that are affordable. A lot of the engineers in India too, I've had the discussions many times. They would like to be like the Americans or like the Germans or like the Dutch, right? We would like to create advanced CT scanners and MRIs rather than actually focusing on the individual problems that you have in India and creating devices that will provide solutions that are actually helping you significantly more than having the same stuff than the Western world has or that the Europeans have. So, and in the case of India or Africa or some other places, making healthcare available is a cost issue and an availability issue, but availability is again cost. So focusing on cost and maybe trying to actually develop something that does the same thing than it's done right now, but maybe by a factor of 10 cheaper or 50 cheaper or 100 cheaper, that would actually really, really drive innovation because it would make devices and things and processes available to everyone. And I think that should be the goal in the future. So just a quick one also on where we move to. I indicated already something about the 4 Ps. So we will have a 4 P medicine. Predict before something happens, then prevent that you get sick, personalize the approach, the healthcare approach, and make sure that everybody participates in that system. Right now, most people, particularly young people, we don't get sick, right? We have no issue with that. But they need to participate in the healthcare from the beginning on because every sick person was a healthy person before. And only by understanding health and what changes from health to disease, you can actually predict things. So that's a lot of data involved in this. So we need to make sure that everybody participates in the healthcare system rather than being a recipient of health care that treats your sickness, prevent from becoming sick. And we also have to, and that's actually the aim of new developments, and my lab is following this very strictly, is we're looking obviously we're not trying to make things worse. We're trying to actually improve outcomes. That's clear. But we also need to work on improving clinical experience for the user as well as for the patient. Now, how many of you, many hundreds in this call, are actually like to go to the doctor? I would assume not many, because there are sick people around. You have to wait for the doctor. He or she has very little time for you. It's a nuisance. You don't want to do that. You want to actually have a clear statement on what your health status is upfront. You want to improve the experience that you have within that health system. The same thing goes for the clinicians. Now, they will only use tools when they know that these tools are trustworthy and create a value. And all in all, we need to make sure that everybody has democratized access to healthcare. We need to look at lowering costs and make everything available to everyone. So where will healthcare be delivered in 10 years? Well, look at this. This is probably not what you expected. That's at least an assumption. We assume that home and everywhere, on the road, in the car, sleeping, whatever, on your vacation, that will be about 88% of where healthcare is actually being recognized, processed, monitored, information provided, and only in a small percentage, 10, 12%, hospital or doctor base. You would have thought it's the other way around. But this is actually preferred. I mean, we all should thrive for these kind of things. Now, I think I've shown that to in Bangalore before when I was there. What is our health dependent on? It depends on social circumstances. Are you rich? Are you well educated? Do you live in a family, or are you by yourself? It also is quite dependent on genetics and biology, something you cannot necessarily change at the moment, even though genetic engineering has the hope that certain things can be altered in the future. You're quite aware and quite know that individual behavior, what you eat, how you eat, what you drink, how you drink, on whether you use drugs, on whether you smoke, on whether you use exercise, has a huge effect on your health in the future. And of course, where you live, does it have clean water? Is the air clean? Are there too many people around, or is it an open space? That is about 10%, and only 15% is actually quality of the healthcare provision. So this is pretty amazing. We are spending all this money and all this effort on these 15% and trying to distinguish ourselves in these 15%, while 85% thinks that are us, we are, as a participant in our own health, could actually steer and avoid maybe. So I'm saying that if you really want to live long and a good life, you have to focus on the 85%. Not saying that we should not invest in the 15, but this is probably more effective. That also brings me to, where should you invest efforts? So if you look on the left, you see the risk and behaviors. I've mentioned them already. These are driving chronic conditions, which are then in essence responsible for 80% of the total cost of the healthcare system. If you smoke, if you live in a dirty environment with bad air, there's a much higher chance that you will have a lung problem. Lung problems, chronic obstructive pulmonary disease, for example, is a huge burden to the healthcare system. Are we really focusing on preventing these things to happen? Are we focusing on these risks and behaviors? No, we are not. We're trying to actually fix once you have the problem. So I think we need to have a shift, a disruption in the healthcare system, and that will also be hopefully stimulating for some ventures, some entrepreneurial efforts. Now, COVID is shit, sorry my language, and it's something that we all are sick and tired of and we would like to go away, but it has actually done one really good thing. It has generated a significant push towards digitization in healthcare. So what people thought was decades away is actually just happened within a very short period of time. So if you really look at just telemedical approaches, you and look at the numbers, this is the numbers of patients that saw a doctor in person from March to April this year in the United States. And at the same time, this is the number of people who saw a doctor virtually by connection. So do you really believe this will go back? I don't think so. I think when people are somewhat satisfied with that setup, they will keep it. And so COVID has done, besides all the bad things, has done actually a good thing of moving digitization and advancement in healthcare significantly forward. So However, there's a lot of things to do, and telemedicine is not telehealth. There's a huge difference between that. Telehealth is actually using digital information and sensor information, using AI, putting this together to actually create a predictive model of what will happen. And there's also a lot of healthcare stakeholders involved, the hospital itself, physical therapy, outpatient facilities, that all need to be integrated in such a digital model to really create a telehealth model rather than a telemedicine model. That's what we call interconnected health systems. And I think we're far away from actually having all the tools available for this. So looking at India, I thought it's really important and interesting to look at what is really bad about that system maybe in India. On the other hand, I have on the right side, you may expect that to come. What is really good about that system? What is the advantage of the system in India versus everybody else's? Well, what I've recognized being in India, you have a relatively uneven, unfair access to healthcare. So if you live in a large city and you have money, you have access. If you're poor or you live in a rural areas, you have problems. It's relatively expensive, at least getting good healthcare to a large portion of the population. I think that the Indian government is doing quite a bit to improve this, but that's still what it is the case. There is a huge difference between access in rural and urban areas. And obviously, education and health staff is lacking behind. It's also not taking into consideration all the technology developments that we have. On the other hand, you have clear need statements. Now in Germany, we can complain on a very high level of, oh, that takes so long. But in essence, we really don't have a clear stated need. Now look to the left, you have clearly stated needs. All these things on the left are not happening in Europe or in Germany, for example. So we don't have this problem. I also see that technology adaptation using digital tools is significantly higher and faster in India than it is in Europe, believe it or not. And the increase in longevity, which is a result of all the efforts, is steeper in India than it is in Europe. In Europe, we have this incline, right? So we increase more advancement and technology will live a little longer, but the slope is significantly higher in India. So you're actually catching up dramatically faster and even probably surpass us at some point in time. And you have all of this, you have what we call, I think Abhishek mentioned it already, reverse innovation opportunities. So you can develop things for India that have a value and then export it back into other countries because you have proven a point in India. So there's a lot of questions that arise from this. Maybe I don't want to go through them in detail. If you have some time, just look at some of them. Questions are the essence of innovation. If you don't ask right questions, you will not get the right answers. Or if you, the other way, if you ask the wrong questions or questions with an obvious answer, how helpful is that? So, like, look at question number 3. That's a very difficult one. Should healthcare remain a business? If yes, what are the guiding principles behind it? So, I mean, we don't have to discuss this. I don't want to have an answer, but is it really a business? If it is a business, there will always be differences between people who have money and not. But do you want that? Do you think that's really good for a society? Or is healthcare not a general right or something that a government maybe should take care of? I'm not giving you an answer. I'm just raising a question. And if you have this question, you may actually come up with solutions that help democratize, make healthcare accessible for everyone. So what do we expect? We expect some disruption. I believe there's some disruption. We're way behind in healthcare with digitization. We're way behind in adoption of new business models. And I think there will be new business models and they will come with disruption. So we'll have a shift to home care and prevention versus what we have right now. That will come with new business models. If you do your own health assessment at home and monitor, is there health insurance involved? Do you pay a doctor? No, you don't. It's done on your own. So it's a different business model. I'm not entirely sure that I know what the business model is, but there will be a different one. And I put this just as a slide. By the way, I can share these slides if you want to, Abhishek, at some point in time. So we don't have to go in depth through all of these. There will be dramatically different business model than what we see right now. You won't pay for a doctor's service. Maybe you pay for staying healthy. Maybe that's a better way of reimbursing stakeholders in the healthcare system. All right. I just listed a couple of the companies. So I have been involved in 34 companies on the left, and red is in Germany a bad color and green is a good color. So this traffic light approach is typically working very well. look at the red colors. I have failed so many times in the past. I failed a little less when I started founding than when I was invested in, and there were some green ones. And I have actually, people have told me that in average I'm not that bad. So I'm not that good really either, but I'm not that bad. So which means that, starting a company comes with a high chance of failure. I don't think there's anything wrong with that. It's just wrong if you can say at the end of the day, if you failed, you didn't ask the right questions and you did not address a problem. And if you look on the right side, and I also don't want to go into depth in this one, those are some of my most recent investments in ventures. And in essence, what I'm trying to do now, which I didn't do before, I'm focusing on actually addressing a clearly formulated medical need, and I'm trying to focus dramatically on cost, which I haven't done before. I was kind of like cool about it needs to be really technologically cool rather than economically cool, or providing a value proposition that really saves a lot of money and still provides a good feature. That's what I believe is the future. And if you don't know how you reduce costs by keeping the quality high, you may have a problem. So really think about this problem that you try to address, think about what technology will do to it and how you can save dramatic costs compared to the status quo. So that's my statement basically, what I've learned, or not, but I believe I learned. I'm only investing now in concepts where I see that the people behind it have thoroughly tried to understand the problem in combination with future technologies. Because understanding a problem is one thing, and even creating a solution for that is another thing. If you know that technology will surpass your idea in the next 5 to 10 years, because AI will actually do more, or the robotics will take over. So you need to take a combination of future problems, cleverly asked questions, and understanding of where healthcare will move to in combination with what technology development will provide a change. My dog in the background, if you hear that. Um, so that's really what I like. And I want to show you some tools that I use. Maybe you can use them in or can introduce them in India as well. But I believe that is a very important thing. And I start with all these type of innovation methodologies. There's not only one, I believe, where you use the biodesign approach or you use a value proposition. There's a multitude of different tools you can use. I am actually mixing and matching them whenever I need them. And I pick the ones that are most appropriate for asking the right question and providing solutions to that question. So one of the things that I think is the most powerful one is what we call the value proposition canvas. I think you have used that, Abhishek, I'm pretty sure you did, where you basically try to go for the stakeholders. So in my case, it would be a private radiologist, and you focus on the main value proposition, in this case, cheap and easy to use. And you try to match or try to find out on whether your proposal, which is on the left side, matches the needs of the stakeholder that is on the right side. And if you have not done that, well, then I question whether you understand the problem. Now, in this case, all the ones which have a red one and then turn into blue, or the red ones that turn into green, I consider the most valuable ones, the most important ones. And when you use these, you can actually create a one-page statement on it. This is my elevator pitch. So basically, out of this value proposition, you can now create a sentence and describe what you really want to do. And in this sentence, you should understand what your proposal is, what problem you address, and how you're actually going to go about it. A very powerful tool. I also expect from people to have an MTP. An MTP, even people don't know it, is a massive transformative purpose. So what do you really try to achieve? It's in my case, safe, easy, affordable healthcare disruption. That's a very powerful, a transformative purpose. That's what I want to really do. I want to create affordable health disruptions. And that's what I'm thinking about. So, and as a difference to a mission and a vision, a mission is something which basically is an action you can do and it is a goal for the future. And the vision is a more of a short-term goal. But please have these in place. You can always adapt them. Very powerful. This MTP comes together with what they call internal and external attributes. Internal is abbreviated ideas or interfaces dash, but I don't want to go into this in depth. Read up on it. It's called the exponential attributes. Very powerful tool, and you can combine those. Let me jump over this quickly. You combine those with an Excel canvas where you basically identify which of these attributes you can use in the future on your device, and then you can plug them into a business model canvas, which I'm sure that Abhishek has also used in the past. Having all these done, you can actually then create a really powerful tool that you can use as a business plan. And by the way, I hate business plans, and I don't want to ever see a business plan anymore that does not include these kind of components. And then the last one I want to show is something called, I picked it up, it's called a one-page strategic plan, and it's based on a BHAG, a big, hairy, audacious goal. And the big hairy, it's here on the right side in the middle. This big, hairy, audacious goal is your vision, is your future purpose. And around that, you build a one-page business plan. And this is almost sufficient to actually convince an investor to invest in you, because he thinks, yeah, he has a clear plan, a clear idea. So this is what I like to see these days from entrepreneurs. I like to see an exponential attitude, an exponential plan. I like them to have worked through a value proposition canvas in combination with a business model canvas, and then use this one-page strategic plan to actually show that they're able to transfer this idea into a real concept. Okay. I think I'm not going to go into this one. So as a summary, there's a lot of questions you should ask yourself. And these questions all bear enormous innovation potential opportunities. And you should also understand the problem deeply. If you don't get into the problem, and I ask 2 questions, you can answer what the problem statement is, I would not be interested. You should try to actually understand that moving into prevention and prediction is significantly more powerful than treating diseases. And you should show all these devices or these helpful setups that I've presented here. They are more important to me than a business plan, because they're easily explainable, and they show that you really have thought the problem through. And with this, I stop talking, and I hope you had at least some input from that, and some valuable information that you can use in the future. Thank you very much. And now let me kick my dog out.
Yeah. So students, if you have any questions to Professor, you can post it on the chat window, and I'll be happy to read it out.
Well, there's hundreds of students on there. There must be tons of questions, right?
Yeah, I'm very sure about it. Or you can just raise your hand. I can unmute you also. That's also possible.
Come on, guys, don't just help me out here. If I give a talk about 25 minutes and I have 250 or 290 people on there needs to be questioned. Otherwise, I'd be frustrated.
Are you guys there? You are able to hear us? Can you say yes? Yeah. Can you say yes, no, something? Oh,
yes,
okay.
Sir.
Okay, I see people are live and they're able to hear us, but do you have any questions? Okay, I got a private chat saying what is difference between innovation and reverse innovation?
Oh, well, my definition of innovation is, I think there was somebody else who said innovation is invention plus commercialization. I replaced the plus with the multiplying with the multiplying sign, because if commercialization is 0, then innovation is 0. If you have an add-on, a sum, then you still have some form of innovation. So what I want to say with that is, if you have a good idea and you're not able to find anybody who's interested in buying that or using that idea, it's not an innovation. It's simply a concept. Right? And most of the ideas that we create these days are concepts. They will never turn out to be an innovation. That's why to actually move from the idea into the commercial space and understand what is it used for is significantly more important than the idea itself. The idea will develop once you understand the problem. Now, reverse innovation is that's a little, it's a little, how would I say this? It's not quite fair because it means that we in Europe and in the US are significantly cleverer than you guys. That's the basic. So basically, we develop things in Europe and the US, and you will never actually have anything very valuable in India because we don't need that. That's wrong. That's a completely wrong statement. But this is a little bit the attitude that we have. So what you have to do is you have to create an innovation, again, invention times commercialization in India, for India, solving your problem in India. And once you have solved this problem, a need statement problem, you can say, by the way, Germany, don't you also need this? And then probably the answer is, yeah, we do need this as well. And this is what we call reverse innovation. So we don't create in Germany innovation for Germany, but we take the innovation from India, create it for India, and say, ah, that's cool for Germany as well. Reverse innovation. I hope that answers the question.
Yeah, I have got another question. What makes innovation sustainable?
Sustainability is a combination of environment, people, and economics, right? So it needs to fulfill these three things, and it somehow there needs to be an economic model behind it. But I'm not sure what that always looks like. But an economic model is not always one where people get rich, but where you basically see that people use it. So there's an actual use model behind it. Sustainable also means that we should not do things that are extremely expensive and take a lot of resources, but we should be very careful with the resources that we take, and we should obviously look at solving the problem for ourselves, which is our health. So that's what makes it sustainable: is having an innovation that is cheap, doesn't take many resources, but solves the problem of actually keeping you healthy. That's at least my definition of sustainability.
Okay, awesome. I don't see any other questions, but I'm sure the students will come back. So we are using Canvas as LMS.
There's one more question right there.
Yeah, two more actually.
Uh,
So do you think there is equal opportunities for all kinds of innovation like there is for medical innovation?
I'm not entirely sure that I understand that question completely. Uh,
So
does it
if
mean
I can elaborate, so she's talking about if like medtech innovation, what you spoke about, is it something equal opportunity we get for like fintech or any other kind of innovation?
I think so, but I think what people do wrong in a lot of the emerging countries is that they always want to be like the fully developed, the fully industrialized countries. So the Indians want to be like the Americans. But why are you not trying to be the best Indians that you can be, and actually trying to solve your individual problems rather than taking over all the issues that are created by the industrialized nations? So what I'm saying with that is solve the problems that you have in India and try to actually make the best out of it, and then see on whether these problems are actually can be adjusted and can be exported to the other nations. And I believe it's not only for medtech, it's for a lot of other things as well. I think you're significantly more powerful than you think.
Yeah, user innovation is really good to do. So one more question is when we talk about disruptive innovation like improvising existing product in healthcare, will doctors or clinicians treat them against their expertise? Say the innovative product needs no less expertise of doctor.
Well, the biggest problem in actually introducing innovation in the healthcare space is the doctors. The doctors are by far the biggest health innovation blockers because they always feel that their job will be jeopardized. I'm a completely in disagreement on that one. What I believe that a doctor should do the best that they can do for their patients, and why not use advanced tools that actually help him or her make a proper diagnosis, a proper decision. But they believe that they will be eliminated by that. And I disagree. I believe they will get a different role, but they will get a more valuable role as a healthcare coach. And I think that will also free up some of the capacities and will probably give the doctor more time to spend with a patient. But the biggest issue in this one is that technology needs to be come with trust. So the doctor needs to trust in the results, and most of them don't do that at the moment. And one of the reasons I believe, and that's why we need to change some of that too, is healthcare education or medical education. Technology is pretty much not a topic in healthcare and in clinical expertise or education. None of them learns anything about AI. None of them learns anything about robotics and any about the tools that probably could help them. So we're lagging. The content of education is lacking the technology that we have, unfortunately. But that's not only in India, that's everywhere in the world. So Germany, it's the same thing. And I saw this question with innovation refer to technology. No, of course not. There's another tool, an innovation tool called innovation segments. And the most valuable innovation is business model innovation. So if you have the same device, for example, you use it in a different business model, like a car. If you have a car and you have another car, the innovation is only incremental. But if you sell a car versus you have a rental model for a car, you pick it up on the street. That's a different business model. And this business model is significantly more innovative than actually doing some little changes on cars. Will innovation affect the economy of people in the future? Yes, it will. I don't know how.
Okay, so thank you very much, Professor. So we are using Canvas for learning platform for our students. So there'll be a lot of discussions which will happen. So I will pick some questions and email to you for answers. If and also maybe once you share your slides, I'll share it to our students, and they'll be having some more doubts, and they'll get back to you.
Yeah, I'll
But
mail. I'll basically I'll mail them to you right away after this.
yeah, sure. So thanks a lot for this amazing session and introducing a lot of new terms for our students. So all of them are sophomore students. So they have just entered sophomore. So they are really good. And the way they're submitting the assignments, and every week they're having assignments on the course, and they're following a lot of things, new things they're coming up, and amazing set of innovation. So I have their elevator pitch. I used the same way what you had showed for us long back when you visited Bangalore. The same format I shifted, I gave it to our students, and they've written very good elevator pitch. I'll be happy to share that to you so that
I'll
you
be
can look and you can give some feedback if possible for at least few of the teams. So with this, thanks a lot again for joining us in the afternoon for you, but evening for us. And it was really good to have you with us.
okay. Thank you very much. Have a good
Thank
one.
you.
Bye
Bye.
bye.